Hi, everyone. It's Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness in Anaheim Hills, California. Trying to figure out where to look. There we are. Anyhow, I just wanted to give you a little bit of an update of what I've been seeing here in our community and kind of how you can best prepare and help yourself so that you're not trapped with COVID or coronavirus or really any other virus for that matter, because everything's kind of inundated and very backed up. So it's a difficult time to say the least. So what can you do? What I'm seeing here in our clinic and our community is really, really high levels of positivity of coronavirus. We're seeing a lot of COVID, a lot of positive cases, and people by and large are doing very well. And they're doing well because they're seeking care, they're coming in early, they're getting management and direction at an early stage. So that's what I really want to encourage for you is to make sure that you're seeking that care early. You're always welcome to call us. We do phone consultations as well if you're not able to get that care in your area. I know a lot of doctors' offices are closed. That being said, the patients who are not doing as well are those who kind of wait and wait and wait, and they sort of wait a little longer. And when they're about 7 to 10 days in, and they're really struggling to breathe, they're still having fevers, they're still struggling through it, then when they come to see me, they already have pneumonia a lot of times. And it becomes very difficult for us then to manage as an outpatient. And again, even in the interest of me sending patients to the hospital several times, sometimes there's not room at the inn, so to speak. So there's no room for them to be taken in and being managed. So it can be quite difficult. So we want to make sure to catch you before that happens. So how can you best manage yourself? One, obviously avoid exposure. If you see somebody who's actively ill, try not to be around them. I mean, that kind of goes without saying. I think that's what everybody's been really trying to do as far as our social distancing and all the rest of it. But now you've been exposed, let's say, and you're really concerned about it. Make sure that you're hydrating. I cannot emphasize enough. We had a saying in surgery that the solution to pollution is dilution, right? So anytime we're polluted with any kind of virus or bacteria or any other sort of pathogen, the best way to sort of dampen the response to it is to dilute it out. So we want to flush it out as best you can. So make sure you're drinking fluids unless you've otherwise been directed by your physician to limit your fluid intake, and then you should talk to your physician about that. Nextly, you want to make sure that you're taking your vitamin D. This is critical, and actually don't even wait until you've been exposed to take your vitamin D. You want to be on vitamin D on a regular basis. I've already done a couple of different episodes about the importance of vitamin D, but particularly for its antiviral benefits, you want to be on a relatively high dose of vitamin D. So again, there's something we do here that's called the vitamin D hammer. You can look that up on PubMed or the NIH. They have multiple studies regarding high doses of vitamin D and how that can be beneficial against viruses. Again, consult your physician about what doses you can take. If you're not kind of getting the answers you need, then we're happy to help you through that as well. Next, you want to be on zinc. Zinc 30 to 50 milligrams. Usually for an adult. Again, this is barring any other medical issues or absorption issues that you might have. Zinc is one of those guys that you want to be very careful with because more is not always better. So it doesn't mean that if I take one, I should take two. You want to really limit it to about 30 to 50 milligrams because in the long term, if we do take too much, then it can impair our ability to absorb iron and copper. So we do need all of those elements in our blood. So we need to make sure to kind of limit it to 30 to 50 milligrams. But it is a fantastic antiviral. It is fantastic at preventing the virus from entering the cells and replicating. It's also beautiful in its design of helping to decrease the inflammatory cascade. Remember that people are not dying from the virus overload per se. They're dying because of our inflammatory response to the virus. So you want to limit that inflammatory response that you're having. That's going to be the key of kind of nursing yourself through this. Nextly, you want to be on quercetin. Typically, quercetin is about 500 milligrams a day. I haven't found anything about being able to like overdo quercetin, but you might want to fact check me on that one. But definitely you want to be on the quercetin. That's going to help you as a flavanol. Flavanols also help as antiviral and anti-inflammatory antioxidants. So it's going to pull out all the damaged tissue that your body has already caused or that the virus has caused. It's going to help pull that stuff out, help to lay down new tissue matrix, and kind of get you floating through it and get better. Vitamin C is another very, very big antioxidant. So again, it's helping to pull out any of the damaged tissue, the free radicals that get formed when tissue kind of gets destroyed. So it's pulling all of that out of our tissue and allowing for new tissue formation to occur. Again, there's always this hot debate whether or not is vitamin C good? Is it not good? Oh, there's not evidence to support it. Where there's not evidence is there's not evidence of like how much, how often, what should you take? Should it be IV? Should it be oral, etc.? So that's where the debate really comes in. Where there's not a debate and there is plenty of evidence supporting it is that we know that people who have higher vitamin C levels do better with infections. And that's true for influenza, rhinoviruses, coronaviruses, you name it, viruses, right? So they do better. We know that people who get a virus will quickly deplete their store of vitamin C because our body is basically using it up as fast as it can in order to lay down that new tissue matrix and pull out that damaged tissue. So somehow we have not made that connection yet to say, well, if we have high vitamin C levels, we do well. Our body uses up our vitamin C when we're sick. So maybe we should replenish that vitamin C to get our levels back up again. And that's the connection that has yet to be made in conventional Western medicine. But a lot of us in integrative health or even just kind of moms, like we just sort of know this, that vitamin C definitely can help. So again, I would be on vitamin C. I usually recommend about 1,000 to 2,000 milligrams, but you want to divide up. If you're going to take 2,000, divide it up, take 1,000 in the morning, 1,000 in the evening, because it can cause a lot of GI upset. So that's why we do a lot of IV vitamin C here, because we can bypass the gut and not cause that upset. But if you're, stuck at home, you're trying to take it there, divide that dose out, 1,000 and 1,000. Okay, again, barring any other reason why you shouldn't, by your physician. But otherwise, vitamin C is very benign. It's very safe. It's water soluble. Your body just kind of gets rid of the excess. You want to be on a B complex as well. There's, again, a lot of evidence supporting flavanols against COVID. So you want to take those as well because that's going to help with anti-inflammatory and immune boosting properties. So being on that B complex is going to help with those flavanols. And then turmeric also is a very good anti-inflammatory. Other anti-inflammatories that you might want to use are things like ginger and cinnamon. Black pepper can potentiate turmeric. So you can get all kinds of complicated on it. But really the biggest key would be vitamin C, zinc, D, and quercetin. Those are the big four. We also use a lot of magnesium here in the office to help decrease lung inflammation. It can also decrease headaches because that COVID headache is something fierce. It is a terrible headache. It also helps to lower anxiety and helps to lower insomnia. So it helps us sleep. And again, a lot of us, pretty much everybody out there has had some kind of virus at some point, and you know how important that sleep is. It gets to be, like, gosh, if I could just get one night's sleep, I could heal and get through this thing. So hopefully this is helpful. Definitely, if you're having any trouble, then give us a call. We're happy to help you through it and give you some guidance. You can do this. Again, staying hydrated is really, really key. Early intervention, assertive intervention, being very proactive about this is going to be your best bet at getting a handle on it quickly and getting it out of your system so that you can move on with the rest of your life. Again, I hope this helps. If you have any questions, please give our office a call. We'll talk to you soon.